7 common medications that can damage your kidneys. We live in a time where medications are essential for treating a wide range of health issues. From minor infections to chronic illnesses, these drugs can greatly improve our quality of life. However, it's important to know that some medications can harm our kidneys, which are vital organs that filter waste from our blood and keep our body's balance of fluids and minerals. As we age, our kidneys naturally don't work as well as they used to, making them more vulnerable to damage. Certain medications, known as nephrotoxic drugs, can directly or indirectly cause kidney damage. This can range from mild issues to severe kidney failure. The risk of such damage increases with age and existing kidney conditions. There are 2 main types of kidney damage from medications: dose-dependent toxicity, where the risk goes up with higher doses, and another one which is unpredictable and varies between people. This can lead to serious health problems like muscle breakdown, kidney tissue death, and acid buildup in the kidneys. In this detailed video, we'll look at 7 common medications that can harm your kidneys, then we'll explain how these drugs affect your kidneys, and finally we will offer tips on how to use them safely. Our goal is to provide you with reliable and factual knowledge to make informed decisions about your diet and health. 1. Antibiotics. Antibiotics are medicines that are used to treat infections caused by bacteria. They work by killing or stopping the growth of bacteria. However, some antibiotics can also have unwanted effects on the kidneys. The kidneys are 2 bean-shaped organs that filter waste and excess water from the blood. They are very important for keeping the body healthy and functioning properly. When antibiotics damage the kidneys, it is called nephrotoxicity. One group of antibiotics that can be especially hard on the kidneys are called aminoglycosides. Examples of aminoglycoside antibiotics include gentamicin and tobramycin. These antibiotics can build up in the filtering parts of the kidneys, called the renal cortex. This can lead to a condition called acute tubular necrosis, where the tiny tubes in the kidneys become damaged and the cells start to die. The risk of kidney damage from aminoglycoside antibiotics is higher if someone is already dehydrated, has pre-existing kidney disease, or takes the antibiotic for a long time. The more of the antibiotic that builds up in the kidneys, the more damage it can cause. Other types of antibiotics, like vancomycin, can also be harmful to the kidneys, especially when used in high doses or combined with other medicines that can affect the kidneys. Vancomycin can cause oxidative stress and inflammation in the kidneys, leading to kidney injury. Another group of antibiotics called beta-lactams, which includes penicillins and cephalosporins, can cause a condition called interstitial nephritis. This is when the spaces between the kidney tubules become inflamed, which can lead to sudden kidney problems if not treated promptly. In summary, antibiotics can damage the kidneys in different ways, depending on the type of antibiotic. Factors like dose, duration of use, and pre-existing kidney issues can increase the risk of kidney problems. Doctors need to be very careful when prescribing antibiotics, especially for patients with kidney disease or other risk factors. 2. Antiviral drugs. Antiviral drugs are medicines used to treat viral infections, such as HIV, the virus that causes AIDS, and hepatitis. While these drugs are essential for managing these serious viral illnesses, they can also have negative effects on the kidneys. One example is a drug called tenofovir, which is commonly used to treat HIV. Tenofovir has been linked to a type of kidney damage called proximal tubulopathy. This is when the tiny tubes in the kidneys, called the proximal tubules, become injured. This can lead to a disorder called Fanconi syndrome, where the kidneys have trouble reabsorbing important substances like glucose, amino acids, and electrolytes back into the body. Other antiviral medications, such as acyclovir and its related drug valacyclovir, which are used to treat herpes infections, can cause a problem called crystalluria. This is when tiny crystals form in the urine, which can then block the kidney tubules and cause acute kidney injury. The risk of crystalluria is higher in people who are dehydrated or already have kidney disease. To reduce the risk of kidney problems with antiviral drugs, it's important for doctors to carefully monitor kidney function and adjust the medication doses as needed. Keeping the patient well hydrated is also crucial, as dehydration can worsen the kidney-related side effects of these drugs. 3. ACE inhibitors. ACE inhibitors are a class of medications commonly used to treat high blood pressure and heart failure. They work by blocking an enzyme called angiotensin-converting enzyme, ACE, which helps regulate blood pressure. While ACE inhibitors are generally well tolerated and beneficial for the heart and circulatory system, they can also affect how well the kidneys function. This is because the kidneys rely on a certain level of blood pressure to filter waste and excess water effectively. ACE inhibitors work by dilating or widening the blood vessels, which can decrease the kidney's glomerular filtration rate, GFR. The GFR is a measure of how much blood the kidneys can filter per minute, and a decrease in GFR can lead to a buildup of waste products in the body. In people with pre-existing kidney disease or conditions like bilateral renal artery stenosis, narrowing of the arteries that supply the kidneys, the use of ACE inhibitors can cause a sudden and severe drop in kidney function, leading to a condition called acute renal failure. To manage the potential kidney-related side effects of ACE inhibitors, doctors need to closely monitor a patient's kidney function, electrolyte levels, and blood pressure. They may need to adjust the medication dose or consider alternative treatments, especially in individuals with known kidney problems or conditions that could increase the risk of kidney damage. 4. Proton pump inhibitors. Proton pump inhibitors, PPIs, are a class of medications used to treat conditions like gastroesophageal reflux disease, GERD, where stomach acid backs up into the esophagus, and peptic ulcers, which are sores in the lining of the stomach or small intestine. PPIs work by reducing the amount of acid produced in the stomach, which can help heal and prevent these types of digestive issues. However, long-term use of PPIs has been linked to an increased risk of developing chronic kidney disease, CKD, and acute interstitial nephritis. Chronic kidney disease is a gradual loss of kidney function over time, and it can eventually lead to kidney failure if not managed properly. Acute interstitial nephritis is a condition where the spaces between the kidney tubules become inflamed, which can also impair kidney function. The exact reasons why PPIs may contribute to kidney problems are not fully understood, but it's believed that the medications may trigger an immune system response that leads to inflammation and damage in the kidneys. Given the potential risks, it's important for patients and healthcare providers to carefully consider the benefits and drawbacks of long-term PPI use. In some cases, alternative treatments or lifestyle changes may be able to manage digestive issues without the need for prolonged PPI therapy, which could help reduce the risk of kidney-related side effects. 5. Diuretics. Diuretics, also known as water pills, are a class of medications that help the body get rid of excess fluid. They work by increasing the amount of urine the kidneys produce, which can be helpful for conditions like high blood pressure, heart failure, and edema, swelling. While diuretics can be very useful, they can also have some negative effects on the kidneys. This is because the kidneys play a crucial role in maintaining the body's fluid and electrolyte balance. When diuretics cause the body to lose too much fluid, it can lead to a condition called hypovolemia, which is a decrease in the overall volume of blood in the body. This reduction in blood volume can then decrease the amount of blood flowing to the kidneys, potentially causing acute kidney injury. Diuretics can also disrupt the body's electrolyte balance, leading to problems like hypokalemia, low potassium levels, or hypercalcemia, high calcium levels. These electrolyte imbalances can further contribute to kidney damage. The diuretics that are most commonly associated with nephrotoxicity, kidney toxicity, are loop diuretics, such as furosemide, and thiazide diuretics, such as hydrochlorothiazide. Patients taking these types of diuretics need to be closely monitored by their healthcare providers, with regular checks of their fluid status, electrolyte levels, and kidney function. Proper hydration and careful dose adjustments are essential to minimize the risk of kidney-related side effects when using diuretic medications. 6. NSAIDs. Nonsteroidal anti-inflammatory drugs, NSAIDs, are a class of medications that are widely used to reduce pain, inflammation, and fever. Examples of NSAIDs include ibuprofen, naproxen, and aspirin. While NSAIDs can be effective for managing various types of pain and inflammation, they are also known to have potential negative effects on the kidneys. This is because NSAIDs can interfere with the production of substances called prostaglandins, which help maintain blood flow to the kidneys. When prostaglandin production is reduced by NSAIDs, it can lead to a decrease in blood flow to the kidneys, a condition known as renal hypoperfusion. This reduced blood flow can then cause acute kidney injury, especially in individuals who already have pre-existing kidney disease, heart failure, or conditions that lead to decreased blood volume, such as dehydration. Chronic, long-term use of NSAIDs has also been associated with an increased risk of developing chronic kidney disease and a condition called acute interstitial nephritis, which is an inflammation of the spaces between the kidney tubules. Given the potential kidney-related risks of NSAIDs, it's important for patients, especially those with known kidney problems or other risk factors, to use these medications cautiously and under the close supervision of their healthcare providers. Exploring alternative pain management options may be advisable in some cases to minimize the impact on kidney health. 7. Lithium. Lithium is a medication that is commonly used to treat bipolar disorder, a mental health condition characterized by extreme mood swings between mania and depression. While lithium can be an effective treatment for bipolar disorder, it is also known to have significant effects on the kidneys, particularly with long-term use. One of the main ways lithium can affect the kidneys is by causing a condition called nephrogenic diabetes insipidus. In this condition, the kidneys lose their ability to properly concentrate the urine, leading to excessive urination and increased thirst. Over time, this can progress to chronic kidney disease if the lithium use is not carefully managed. Lithium can also cause a condition called lithium-induced nephropathy, which is characterized by scarring and damage to the spaces between the kidney tubules, interstitial fibrosis, and shrinkage of the tubules themselves, tubular atrophy. This type of kidney damage can impair the kidney's overall function. To minimize the risk of lithium-related kidney problems, healthcare providers need to closely monitor patients' lithium levels in the blood, as well as their kidney function through regular blood and urine tests. Adjustments to the lithium dose or exploration of alternative treatments may be necessary if significant kidney damage is detected. In summary, a wide range of commonly used medications, including antibiotics, antiviral drugs, ACE inhibitors, proton pump inhibitors, diuretics, NSAIDs, and lithium, can have negative effects on the kidneys. These kidney-related side effects, known as nephrotoxicity, can range from acute kidney injury to the development of chronic kidney disease. Share this video with your loved ones today, and if you found the video informative, don't forget to give it a thumbs up and subscribe to the channel for more content like this.